Health Awareness Month, and on behalf of Mayor and Council, we're pleased to be presenting our residents with very much needed information and resources regarding mental health. I too have gone through challenges within my own family, so I understand how difficult it can be to see a loved one struggle, and also how difficult it can be to navigate the mental health care system. With permission from my family, I have made my experience known, and since then, many residents have reached out to me asking where to begin. I want you all to know that you're not alone, and I'm glad that you're joining us tonight and find the information hopefully useful. I would like to thank South Plainfield Mayor and Council, as well as Wellspring Center for Prevention for organizing the event, especially Sharonda Amon and Heather Ward with Wellspring for being the backbone of all of this and pulling together all of the resources to make this possible. Thank you to our speakers, Coordinated Family Healthcare, Wellspring Center for Prevention, National Alliance on Mental Illness, Middlesex County, and NJ211. Thank you to our Library Director, Linda Hansen, for your help and for hosting this event. And last but not least, thank you to Tap in South Plainfield and Twin City Pharmacy for generously donating our 4 door prizes. With no further ado, I would like to announce Sharonda Amon with Wellspring Center for Prevention.
Good evening, everyone. Once again, my name is Sharonda Amon, and I am the Coalition Coordinator for Wellspring Center for Prevention. At Wellspring, we promote healthy living through education, training, and advocacy. We have been in service since 1980, and we're a nonprofit serving Middlesex County and parts of Monmouth County. We have a Middlesex County Prevention Hub, where people can log onto our website and they can get different community resources throughout Middlesex County. It is an anonymous self-help tool that we use to help people get resources and also treatment services as well. You can also call our office at 732-254-3344, and then you will be able to talk to one of us, and we'll be able to give you those resources as well. We also have a wonderful part of our agency called the CAP, which is located in South Plainfield High School, South Plainfield Middle School, and Grant School. And I have Jordan, who's going to come and tell you more about that.
Hi, everybody. So as Sharonda said, my name is Jordan Indike. I'm an LSW, a licensed social worker. I work in South Plainfield Middle School, where I have an office there, and I am part of Wellspring Center for Prevention. So I want you to think about this scenario. You're in high school or middle school. You're upset about something, maybe it be friends, boyfriend, loss of a grandparent, maybe a fight with a sibling, something like that. You break into tears in class. Who does your teacher send you to? Who do you talk to? What does that person say to you? Maybe nothing. Maybe they have some advice. Maybe they've been through it, so they might relate to you in some type of way. But then they send you back to class and you're expected to just go through the rest of the day and handle that basically on your own. Now, let's fast forward to the present day, and you're in South Plainfield Middle School, South Plainfield High School, or you're in Grant School, and you're feeling upset or you have one of those moments, and instead you're sent to a licensed mental health professional who's able to help you through those types of scenarios. Maybe it's something that's ongoing, so that you're able to see them for an ongoing period of time, and you have a support system that's right there in the school for you. All right, so I'll go into telling you a little bit about what Wellspring Center for Prevention is. So we contract with school districts, and we bring mental health and other health-related services to schools. So we also have a contract with Carteret and Metuchen High School, where we also have services there. Our organization dates back to 1980, so we've been in service for 43 years. We provide substance abuse prevention programs, referral services to county businesses, schools, faith-based organizations, and agencies. We have a 17-year history of bringing mental health services and support services to schools in this county, starting with Carteret High School in 2006, and then expanding to serving 10 other schools in the county. All locations include individual counseling services by trained licensed mental health professionals. Wellspring expanded into South Plainfield High School in 2019, so we've been in this school district for about 4 years now. And this year, with the support of the school district, we were able to expand into South Plainfield Middle School and into Grant School. We have Jean Newworth, who works in South Plainfield High School, and we have Louisa Perez, who works in Grant School. And in both schools, we have our own offices so that the kids can come to us. A little background on what exactly we do. So our purpose is to provide mental health and supportive counseling during the day to our students to help improve the emotional well-being and functioning of students. Some students are seen once to just support them through maybe whatever they're going through on that occasion. But a lot of our students we see on a weekly basis, some bi-weekly, and then obviously if they're going through something at that time, they're able to come to us so that we can help them through maybe crisis. These students often start by showing up in guidance, whether they have social issues, mental health issues, conflicts, or just unmanageable stress. And then from there, the guidance counselors will assess them and determine if it's something that needs to be seen on an ongoing basis, and then they're referred to us. The referrals primarily come through guidance counselors, but they're also able to come through principals, nurses, teachers, depending on what they're seeing in the school, and then we'll kind of just work it out to decide if that needs to be ongoing or not. We typically meet with the students during, in the high school, they have an intervention period, so we'll meet with them during that time in the high school. I pull my students during lunch, during specials. I try to tell them not to come to me during their academic classes because they also need to be doing school, of course. If a student struggles and needs additional support, or if the parent does not want their child seen in school, then we refer them to outside counseling to make sure that they're getting the support in other ways. All of these services are voluntary, so obviously we talk to the kids and then they, in the end, get to determine if they want to, and if it ever wants to be discontinued, they have that option also. In addition to counseling services, in my school, I run groups for some of the kids. I also push into some of the special needs classrooms and we teach general social skills, make bulletin boards for the school. We do SEL lessons in the classrooms for things that teachers find that the students might be needing just a little bit of extra help on, maybe things like bullying or using inappropriate language, whatever that may be. And then we also have therapy dogs that are coming to the school too, which I'm pretty excited about. In the high school, Jean has also done a transfer breakfast for students. So for kids who were new to the school district, they had a big breakfast one day so that they could all get to know each other, so that they had connections. She has a table going at the wellness fairs. She also had a mental health intern that we had that was also helping to take additional students, so we were able to see more than we normally would. And she has a mental health Google Classroom that she's working on now too, so that the kids will have access to it virtually. Some other things that we've offered in the school district is we've recently started what's called the Assist program in the high school. And through that, we had one of our coworkers, Colleen, come over and she would provide prevention education about vaping in the middle school and the high school as an alternative to a punishment. So instead of sending the kids out to have suspension for 10 days, whatever it may be, they would come. It was a 5-week program. They would come on Thursdays for half the day during the school. They would get lessons on what vaping was, how it would affect them, and then after that, we would have a counselor come and they would talk to them for an hour about how to handle like the social aspects of vaping and how to how their triggers might affect them and things along that line. We also had We're Not Buying It come into the middle school, which Wellspring provided. We did vaping prevention assemblies, general substance use assemblies, and then of course Sharon, who organized this program. Last year, for the 7 schools that we served, we saw 1,040 unduplicated students, 353 unduplicated youth were just engaged in mental health counseling, 3,758 counseling sessions were provided, and 535 unduplicated youth participated in group counseling. In the South Plainfield High School last year, Jean saw 109 students for individual counseling and 366 counseling sessions and 99 crisis sessions. So a crisis session would be if they only saw them like once. Overall, we are expecting to provide mental health services to about 200 kids this year, and we have already provided over 1,000 sessions. Thank you.
Thank you, Jordan. Next, I'd like to invite Bray Duncan with NJ211. And I also want to add for for, who we have here and those online. If you have any questions during the session, feel free to type it in. And we're gonna go back at the end and answer questions. Thank you, Ray.
You're welcome. Good afternoon, everyone. Evening. I don't even know what time it is. I'm running on fumes, so bear with me. Again, my name is Ray. I work for New Jersey 211. I'm actually the 211 program manager. So it's my job to go out and find organizations or nonprofit organizations to get them into our database so that we can refer them to consumers in need. So I'm just going to give you a little brief overview of what we are and what we did. We are a nonprofit organization. We were established in 2002 by the United Ways of New Jersey. We are a statewide coverage, so we handle from south, central, northern, everywhere. So far, we've had over 1.3 million contacts. You could have slipped it, that's fine.
Just like kind of give me a.
Okay. We are AIR certified, which means that we are nationally accredited. We follow best practice and standards for delivering the information and referral services to consumers in need for the state of New Jersey. We've been certified since 2015. Our mission is to be a critical connection between individuals and families who are in need of help. Meaning, if someone is in need of help, resources for utilities, mental health, food, they come to us so that we can give them resources of where they need to go. Because half of the time when people are panicking, they don't know where to go. Our mission is to make sure that everyone has a healthy and safe and essential needs for life, which, as we all know right now, everybody is struggling to pay for food. So we're trying to make sure that we're pushing SNAP benefits. We're trying to make sure that everybody knows that they can go to food pantries, local or community nonprofit organizations just to get help. Our core values is that, if you notice, it spells cares. We're compassionate, we're accountable, we're reliable, we're ethical, and our service is excellent. Meaning that we are available 24 hours a day, 7 days a week. You can call us at 4 a.m. and somebody is there to talk to you, a live person. Available through chat as well as text. So needless to say, we never close. This is just a little history of when we started. We started in 1997, the first 211 was started in Atlanta. As you'll see, that it's progressed over the years. 211 became the sole administrator of the 211 dialing code for New Jersey. In 2005, the 211 provides statewide coverage to the service. Somewhere in between there, it used to be 2 separate locations. One was in central and one was in northern. It didn't make sense to have 2 separate locations, so they combined all one, and now it's in northern New Jersey. So present day, we are included our service into writing into the state emergencies plan. So God forbid New Jersey ever has another disaster, hopefully we don't have it anytime soon, like with Sandy or whatever it may be, we are written into their plan so that we can assist the state as much as possible. What is 211? Does anybody know what 211 is, or has anybody ever called 211? Okay. So it's a very simple 3-digit dialing code. Simple as 911, 311, 411, we're 211. We're an information and referral service that we basically provide resources for health and human services. You do connect with a live community specialist, whether it's 7 a.m. or 7 p.m. 4 a.m., somebody is always there to assist you. We do have our website, which is our searchable resource database for government and community-based programs. And of course, our website, again, so has the same information that the specialists will give to you is what's on our website. They talk with each other. So as you notice, I don't know if you guys know, but 211 is available in all 50 states. In the District of Columbia, as well as Puerto Rico. You'll notice that the ones in blue has 100% coverage. The states that are in yellow, or in I guess that's a light gray, have very little coverage, but they're working on trying to make sure that everybody has full coverage. These are just some of the programs that we have that we're working with. So the first one, of course, is the 211 service, which is a blanket service, meaning that it could be anybody that needs food, housing, rent, mental health, anything that they need. Then we break it down into subcategories. So for the utility assistance hotline, we partner with the state, the Department of Community Affairs, to work with their LAHEAT program, which is a heating assistance program. A new program that came out last year, the water assistance program. Then we're also the state homeless hotline, which started 3 years ago. We're also the coordinated entry for the homeless for Morris and Passaic counties. And of course, we have the addictions helpline. So we try to get those individuals who need help with addictions or mental health to get them to where they need to be. These are just some of our initiatives. You'll see that a lot of them are state agencies and some of them are county agencies and some of them are individual agencies that we partner with to make sure that we're getting the resources out to them. So like you'll see that we have Ocean Adult Protective Services. We partner with Register Readys to get people, in case there is a disaster, to get them enrolled. Again, our assistance is free, it's confidential, we are multilingual, and assistance is available 24 hours a day, 7 days a week. Whether it's by dialing in or our 800 number or just dialing 211, chat, text, email, someone is always available to us. Again, I just really talked about that, but this is just information about our online assistance. We have over 6,600 programs. They are updated annually. We're trying to add more. These are our communication channels. We have live assistance, our website, telephone messaging, text, social media. So our roles in disaster, I talked about that a little bit, but we do assist with disasters. We don't assist during the disaster, we just try to make sure that everybody is safe and get them to where they need to go. Our main role is to assisting them after the disaster is over, to making sure that they are in a safe place, that they have food, they have resources that can help get them back to where they were. So far, for 2022, I don't know why I'm saying 2002, we have held over 1.3 million connections. We are diverse in age, gender, race, and language. We don't care what the issue is or who you are, or what you're going through, we will help anybody, except for children under a certain age. This is the amount of contacts that we've had by county. Unfortunately, I can't see the bottom, but I can tell you that the 46,000 is Essex, the second one is Middlesex. And that could be a broad variety of needs that they needed, whether it was housing, utility assistance, homelessness, and stuff like that. These are just a few of our top 10 requests that people call us for. You'll see the top one is utility assistance, housing, and so forth. We get some that are looking for mental health, but a lot of them is not mental health. They're stating that they want to harm themselves. So they don't call us when they need the service. They call us when they're at the point of working. So we do a lethality screening, and then we get them to either the hotline, the helpline, crisis center, or need be the police. These are just our outreach ways. So we have social media, we do have quarterly newsletters, of course we do presentations, we have promotional materials, and we also do participate in events. You can't see the bottom, but if that's something that you want to make sure that your information is in our system or any information that you may need, you can email marketing@nj201.org. For help is just 3 digits away. Is it Ms. Corley?
Yes, okay. I feel like I have something in common with a lot of you because Ray, you talked about 211 and in mental health field, 988 is something new. I saw you had it on your last slide. A lot of people have not heard about 988, but it's new. There are some places in the country and in our state where they're not completely up to speed with getting all the folks answered as quickly as they like, but we're certainly on the way. Probably starting with so I'm glad you mentioned 211 and you got to remember 988. And the reason we like 988 is because if you call 911 and you're having a mental health crisis with someone in your home, in your family, 911 will show up with the sirens blaring and a couple of ambulances, and you know your whole neighborhood's going to be out on their front lawn. Okay, thank you. Wondering what's happening and worrying about you. And lots of times these are situations where you don't really want the whole neighborhood to know what's happening. It's a sad situation. It's a crisis. Someone, is having a hard time. So 911 will get that kind of response. 988 is going to be handled by people who know about mental health responses. They will try to avoid that big, hullabaloo at your front door, and they will try to get you a CIT trained officer. CIT means crisis intervention training. I was just to a short program recently up in Essex County, coming for someone. 30 or 40 officers attend these classes. They spend an entire week learning all kinds of things to help them handle crises. And my goal was to help someone else just talk a little bit about our personal experiences. Because everyone here at NAMI, everyone at NAMI Middlesex, which is where I'm from, sorry, I guess I didn't lead with that. We all have someone in our family who is dealing with a mental health crisis. So we all have a very close personal connection to this. So we presented a little bit to the officers, and it was a really great program. So remember 988. And then I also wanted to mention to Jordan that I was working in middle school for 10 years before I became a volunteer for NAMI Middlesex. So I know the kind of things that you face. And I've also experienced kids at that young age who need some help. So that's really important for you're doing too. So NAMI Middlesex is a volunteer organization. There is NAMI in each county of New Jersey, and so as Middlesex, obviously, there are a couple of counties where they combined because they just didn't have enough workforce. NAMI is all around the country. So it's NAMI, which stands for National Alliance on Mental Illness. And we run a lot of programs, so all three to the people who come to our programs. Mostly, we at NAMI Middlesex work with adults. So we don't really see the students that Jordan was talking about. But lots of times, the kids who are going to Jordan during their school year, or someone like Jordan, they may be experiencing the very first aspects of mental illness. It may be kind of mild, maybe just depression, or it could even be something a little bit more, well, not bad at the time when we're young, but that's leading to something more serious, what we call SMI, serious mental illness. And that would include things like psychosis, schizophrenia, bipolar disorder, very serious depression, depression disorder, sorry, I can't think of the right name for it, MDD, not sure, not coming to me right now. But so the point is that pay attention to the young people, because you don't know where that's going. Be open to the idea of a therapist. It can help to talk to somebody for a little while, how old the child is. This tends to come out more in high school, and then particularly in the college years or work years. When kids get out of high school, they've lost that environment that they're used to, that routine, and things start piling up. They've got a new situation ahead of them in college, or trying to find a job, relationships, all those things, and that's where the serious mental illnesses start to emerge. So we need to be aware of that. So as I said, we work mostly with adults, and we have a number of things to help our adults that we work with. We have a club called Young Adult Club. That's for adults from 19 to 35. And a lot of the people in that club don't get a lot of opportunity to socialize. They might have trouble communicating with other people and finding friends and fitting in. So this is a club that they can come to twice a month, usually once on Zoom and once in an outside area, park, whatever it would be, to talk to other people and feel like these are their people who understand them. And then we have a social outing club, which is similar to Young Adult Club, but for people 35 and over. So it's the same thing, people who need a little socialization and need to find some friends that they can talk to and can understand where they're coming from. And then this would be more important for anyone here who has a young person of any age. You might be interested in this. We have, well, two things actually. We have something called Family to Family, which is a program of education. It runs for 9 weeks now, one night a week, or sometimes on weekends, but usually one session a week, about 2.5 hours. We can take up to 20 couples at the most, or 20 people at the most. Lots of times people come in as couples, that's why I said couples. And they meet people who know what they're going through. And they really get a lot of feedback, a lot of support. They find out that they're not alone in this situation. There are other people going through it. And they get lots of times they make good friendships. But if nothing else, they go home with a really good education on all aspects of mental illness, and they've made some contacts that they can share. And those things are really invaluable for parents who are dealing with serious mental illness usually. And, just came upon them and they don't know what to do and they're frantic and they're desperate. And another thing we have would be good for younger people, younger children, is called NAMI Basics. And I have all this information over on the table. And NAMI Basics is a 6-session education program. I'm reading my little script here because I haven't actually done that one myself. And that's for parents, caregivers, and other family members for youth that goes up to age 22 and younger, who are experiencing mental health symptoms. And it's free to participants, as all of our programs are. And it's taught by trained volunteers who have been through similar experiences. It provides information, tools for parents to use, information about school and mental health systems, and coping strategies in a supportive, confidential setting. And this in-person group gives you the opportunity to meet other parents who understand the online program, and the online program offers the same information as an online course that's available 24/7 and self-paced. So you could either do it in person, it's available at a particular time, we offer them every so often. That's actually offered by NAMI New Jersey, the state organization, or you can go online, go to the NAMI New Jersey site and find the self-paced class, and that will also give you some good information. So there's also a program called Ending the Silence, which might be very interesting to high school counselors and teachers. And in Ending the Silence, it's I think there's maybe a 60-minute, 50-minute presentation where someone who has serious mental illness speaks to the audience and describes what the situation is like, what they've been through, how they're coping, what they've learned, and what they're hopeful about in the future. That's a really good program, and it can be offered in different schools. So if you're a teacher or a counselor and you would like to bring Ending the Silence to your class, that's what for your, it could be in gym health class, it could be for the whole auditorium, whatever. That's something that you can reach out to NAMI New Jersey or me, and I'll get in touch with NAMI New Jersey to help you out with that. And then another thing I want to mention is something called first episode psychosis. Psychosis is a really difficult thing to manage and help people through. I don't know if you're familiar with the term psychosis, but basically it means when a person loses touch with reality. And they might have false beliefs that don't make sense to anyone around them. They may speak in what we call word salad. They say things and all the things they talk about are disconnected, and they go on tangents, and they don't understand why people listening don't really get what they're talking about. Because to them, what they're saying seems to be fine. It's called racing through the mind. So it's a very scary thing, and what researchers have found is that the sooner our young people get help with first episode psychosis, or psychosis, the better. So they created a first episode psychosis program to get young people help right away. Because it's very typical for someone who's going through psychosis to go for about 7, maybe 10 years before they are receiving help. And during that time, there's a lot of things that happen to the brain that aren't necessarily reversible. And basically, their life falls apart. So that's important to remember this idea of first episode psychosis for either in school or working with mental health or thinking about family members. So the faster you can get help when something reaches that point, and again, that would be like an adult, late high school, usually can start earlier, into college, or even up to the 30s or so, that kind of period. So those are most of the things that I want to talk to you about. Talk about Ending the Silence. I could say we have some, my one slide up there. In addition to those statistics, if you got to look at them, maybe some of these are repetitious, they are, but this one, 1 in 6 U.S. youth aged 6 to 17 experiencing mental health disorder. 1 in 6. So think about your school of 500 kids. That's a lot of kids who are really facing something tough that they might not be telling anybody about and that they're worried about, but they're probably not telling mom and dad or anyone else. And then 50% of all lifetime illnesses, yes, it's good, begins by age 14 and 75% by age 24. And suicide is the second leading cause of death among people aged 10 to 34. And maybe it's getting worse. It has gotten worse, I should say. So those are the programs that we offer. You can go online and look for NAMI New Jersey. We have a really minimal website that we're working on now, and it's going to be out pretty soon, and we'll have a lot more information. But in the meantime, you could look at our small website, but you could also go to NAMINewJersey.org, and you'll get lots and lots of information on many of these topics.
So, Rutgers Behavioral Health wasn't able to make it due to last minute urgent matter. So I kind of want to just share my experience because I've actually used them for my daughter. So, you know, my daughter was going through some things. She was with a social worker. Originally, that was not overseen by a physician, right? So let's just say she was with this group, seeing the social worker for counseling. I started realizing that she really needed some extra help. She was going through a very, very difficult time. And I was thinking to myself, well, it's probably time for medication. Things were getting really bad. So being that this particular group didn't have a nurse practitioner doctor, we had to find other resources. It was so difficult because it was at the point where it was very, very urgent. It wasn't an emergency, but it was very urgent. You know, I called so many people. You have to do intake first, which is through the social worker typically, I'm assuming, at least that was my experience. And then a lot of the times the doctor or nurse practitioner wasn't available, you know, 2 weeks up to 30 days out. And I couldn't wait that long. Called my pediatrician, and he said, listen, Melanie, he goes, I can't prescribe her anything because I don't know if there are any underlying issues, and if I prescribe her something, it could make the problem worse. So I said, well, I don't know what to do. Brought her to the emergency room, even though it wasn't an emergency, but to me, it was like, I can't wait any longer. Now, mind you, she's 18, so she was 18 at the time. So she's an adult and she can make her own decisions. She's like, I don't want to go on medication. I don't want to do this. I don't want to do that. I said, let's just go. We'll talk. I was at the hospital, JFK. They said, we can't do anything. It's not an emergency, you know, so she wasn't going to be staying there, but we can refer you to Rutgers Behavioral Health. So they saw her the very next day, had her intake with the social worker, and then the nurse practitioner just about an hour after that. Explained everything to her, really took the time, explained everything to her, to the point where she's like, okay, I'm okay with that. I could do medication. It's what she's saying I need. And I feel comfortable knowing how she explained it to me and why I need medication. So that's okay. So I thank God for them. It gets really hard as mom, you know, going through that kind of stuff. So I didn't want to go without mentioning them. And also, I also wanted to mention Perform Care. I know there are many services that can help when you are underinsured or uninsured. They take insurance as well. But there was a long period of time where we were uninsured. And Perform Care was also great. So I just wanted to let everybody know about that as well. And that's it. I really thank everybody for being here, and we'll take some questions. Do we have any questions? Oh, sorry. It's okay. Come on up. I didn't write it down, so introduce yourself.
It's okay,
I'm sorry.
actually, perfect segue, because she started talking about Perform Care. So although I'm not from Perform Care, I am from the Middlesex County Care Management Organization, and Perform Care is the contracted systems administrator who gives and triages youth throughout the entire state. So you have to go through Perform Care no matter which county you live in order to access the care that's been mentioned before, mental health resources for youth and families. So we can just start right there.
Excellent.
We won't take up a whole bunch of time because I think we have questions already. But I just generally want to give you an idea of how to access, right? Because we started talking about families. Really, really happy that kids have not been forgotten. I think it's really important. We focus on May as Mental Health Awareness Month, so perfect timing. But I think a lot of times when we talk about kids, we talk about that 6 to 10 year part of where you're waiting to get services or access or be seen for the first time. And that's totally not where the state is. So we want to make sure that access is available. You know where to call, you know who to reach out to. 211 is excellent. They'll give you Perform Care's info. We all work together as a local system. So Middlesex County is really tight. Rutgers UBHC, the Care Management Organization, 211, Mobile Response. We all know everyone. They have a success center that's just one of 4 in our county who are like phenomenal. I am so blessed to work with them consistently and send families to them. Sort of about that. But so our children's system of care, I am Lisa Marie Williams. I am the resource development manager. I am in charge of getting all those providers and resources and making sure that everybody falls in line when they're supposed to so that we can provide quality care to our youth and families of Middlesex County. So again, our kids have moderate and complex needs in the state of New Jersey. So the children's system of care covers the whole state. We're broken up into different categories. I obviously cover Middlesex County. And youth who have chronic medical conditions are also in line for some of these services, but not in Middlesex County. So just so you know that other counties, you may hear that there are resources for those youth. They are just not here yet. We don't know what that's gonna look like. There's always a possibility. You never know what's gonna happen. We first really started out with working with behavioral health need youth, and now we serve every youth in Middlesex County that's in need. So we have expanded. Again, this is what we look like as far as the state and how it's broken up. We do provide intensive care management services to youth who have social, emotional, behavioral, mental health, substance abuse, and developmental needs. So there's no youth that is in our state or in our county that's not going to be able to receive support and services. So again, Perform Care is who the state contracted. They hired them to take all the referrals in the world, or all the referrals in New Jersey, triage them and determine where are these kids going to fall. Do they need intensive services? Do they need somebody to come to their home within 2 hours? Do they just need referrals? Do they need resources? Perform Care is the agency that's going to make that determination. So no one can come to the CMO directly. Doesn't happen. You have to go through the triage process to make sure that other resources are exhausted. We are really at the top level of serving those youth who are at the highest level of need. Go back to this, I'm sorry, the slide before. Just so you know really quickly, we started serving kids who were 5 to 18, and then youth who were involved in any system within our local system, right, which includes us, which I'll show you a little bit about. DIFUS, formerly known, it's now known as DCPP, up to the age of 21, and now we're serving kids 0 to 21. So that's brand spanking new. Mobile Response has already been trained about serving youth basically until 5 years old, and we're up next. So we're getting ready. It just seems like we keep expanding, keep covering. That's really what I think comprehensive quality care looks like. It doesn't mean you stop and start. It means you continue wherever you are. If you have to leave and come back, you can. And we pick up where we left off. So although We do utilize families' insurances for resources because it makes sense, it's sustainable. We don't charge families. That's not something we're in the process of doing. We don't do that. We do help families apply for New Jersey Family Care because we want to make sure that whatever services they may be eligible for, that they're able to receive. So although I mentioned we help families apply for New Jersey Family Care, we, with our own agency, are able to provide a certain amount of services that other community entities cannot provide. So just being in our system alone gives access in itself. Those are very short-term services. Those are very intensive services. Those are very time-limited services. They are not sustainable. They are to help stabilize families and youth. They're utilized to help create a linkage so that families can use what they do have for a long-term process. Support them better. So here is just, if you go to the performcarenj.org website, there's so many resources, especially if you're trying to explain, like, it's really hard, right? Families are like calling 211, they're in crisis, they're having a hard time. They have kids that they're worried about, no matter how old they are. If they're 8 or 18, they're still your children. And the fact that, having to explain to a family, well, you have to call this number, you have to get triaged, and then you have to see where you land in that whole, variety of services. Sometimes it's better for families just to see a video. They're short, they've really done a really good job, Perform Care, especially for school entities. I always encourage our SACs, our social workers, nurses, principals, to use this as like a training tool for personnel in school. We do have a very close relationship with the McKinney-Vento liaisons in the school districts, for our homeless families, because we know that those are the highest at risk, right? You don't have a place to live, you're not eating, what's happening next, no medical care. So we know those families in particular are at risk, and we've made connections with those through the county. So we encourage any and everyone, if you have questions about Perform Care, to please check their website, utilize their videos, share them with pockets of individuals you think may need it, or get your own answers, your own questions answered. They are just very informative, but I know we don't have time, so you can go to the next slide. This is what our system looks like. This is what your system looks like. This is what Middlesex County local children's system of care looks like. So the Department of Children is where we fall under. Although the care management organization is under DCF, we are not a state entity. We are a separate local nonprofit. So we have flexibility to do different things than other state entities do, but we also are guided by Medicaid. So that's the restriction there. We also fall under and work with all of these systems. So if we have a youth who has juvenile charges, we're going to court. If we have a youth in a family who has permanency and is not living at home, we're with that youth and we're care managing them with their other case managers and whatever system they're in. If we have a youth who's living at home, which is always our goal, right? Because if they're out of home, they're coming back. They're coming back to the community. We want to make sure that's going to work. So we're working with their pastors, their teachers, their family members, whoever the legal guardian will allow us to do work with and invite them to the table. Then we talk about mobile response, we talk about the family support organization, and we talk about nonprofit, other organizations, community-based organizations like the Family Success Centers. That's who we're getting to the table to kind of sit down, talk about what does this family need and how we can refer. So we are facilitating, monitoring, and implementing any and all services once we receive a referral. This is what the divisions look like under DCF, so there's many. It changes, right, based on whatever commissioner we have and what the name's gonna be and all that good stuff. So we roll with it, and so good to see. We have actually a division on women. We have an adolescent division, which, yes, like these kids turn into adolescents than adults. So we need to prepare that very special population who requires special and trained facilitators of how to provide that service. We want to meet the need of the kid and not have them meet the need of what we're providing. Nonprofit, as I mentioned, that's who we are. So although every care management organization has their own separate name, we still are all the CMOs. So you go to Morris Sussex, they have a separate name. I think it's Morris and Sussex of Passaic County. I think that's their partnership name. And then we are Coordinated Family Care for Middlesex County. So every CMO has a different name depending on what counties you're in. Some of them will lump together, Morris and Sussex is lumped together. I think Tri-County, which is Somerset, Warren, and Hunterdon, they're together as one CMO, so it exists throughout all of the counties in the state of New Jersey. We have a strength-based process that we follow. So although we know that we get a file, right? We get paperwork, we get stuff from UVHC, we get stuff from the school, it looks horrible. It's bad, right? Like we know that they may have juvenile charges, we know that they may have been hospitalized 17 times, we know that they may have been homicidal, suicidal, and that's all fine and great. And we don't say that that's not something we're gonna pay attention to, but we're also not gonna focus on that only. We're gonna try to bring this family and this kid to a stable place where they feel good about themselves, where they are connected to their community and they can do well in school and at home. We right now have about 1,300 kids. I'm sorry, by Friday we'll probably hit 1,400. So there's kids in South Plainfield that we are care managing. They are the kids that are going to your schools, they are the kids that you are supporting, they are your own kids. They need support and we're here to support them as best as we can. Just as any other entity at this point, everybody's struggling with staffing, right? Like everybody is struggling really hard to get people trained, to get people back into the workforce that looks differently. Social work has always been a small pocket of professionals, but we are really doing our best to try to bring care managers in, supervisors, and provide the care management services utilizing the nurture heart approach to families and kids and in the community as well. So here again, just a description of who we serve and just really trying to make sure that wherever our youth and whatever realm they're in, we're with them. So again, it could be in the court system, it could be in the hospital system, it could be in the mental health system, it could be in the educational system. Wherever they are, we should be. There should be a care manager that's helping, that's connecting, that is leading the way until families can do it on their own. So just some more about criteria. That most important number for us is perform care, so the 1-877-652-7624. I have brochures in English and in Spanish in the back about CMO, about coordinated family care, along with Nurture Heart. We do provide Nurture Heart training for other entities because we have certified Nurture Heart trainers, but you can also pass that information around to anyone that may need it. Again, the areas of where we serve, we're in DCPAB court with our families, we are in the juvenile justice system. Generally our youth have a DSM-5 diagnosis, but sometimes they don't. They're in the process of getting it, they need evaluations. We're gonna help that family dig deep and look what resources that they have and what we can provide in a short-term period of time. So the IDD journey, right? We love to use acronyms and confuse everyone that we work with because why not? But the language that we use, we really try to be family friendly, but we always revert back to the acronyms that nobody knows about. So that is the intellectually disabled individuals that we're working with who came to us probably about 5 or 6 years ago, I wanna say. That DD department that existed at the state was closed and they just moved those kids right over to us. So everyone in every county then started serving youth who had developmental disabilities. It's been one of the most eye-opening experiences, I think, for the care management organizations. We used to always separate the mental health, right, and the developmental needs of families and kids, and then come to find out how much those meld together and what they mean. And so really just trying to make sure that families who have youth who are on the spectrum, who do have a developmental disability, that we are definitely connecting them and using their resources long-term wise. Here are where our kids come from, majority of them. Again, by Friday, we'll hit 1,400. So New Brunswick is our highest referring source and where youth are living at the time. For Danbury, Edison, East Brunswick, and then you see like the 6% for East Brunswick, and that probably trickles down to the rest of the counties to make up that 100% of where kids are living, and what that looks like. And then the ages, yes, our teenagers, I knock on wood all the time because those are the majority of the kids that we're serving. I knock on wood that we keep them safe. We keep themselves safe. So language, huge, right? How are you providing services if English isn't the first language of the family or the only language of the family, and what are you doing with that? So right now, the primary language for CFC families is English at 83%, and then 16% primarily speak only Spanish. That does not mean that there's still not a language barrier to services. That just means what the primary language is. We have a huge pocket of families, and I think I just did pull the report last Monday for our county, which was that we had at least almost 400 families identify as other. What does other mean? I need to know. I need to know what other looks like if I'm looking for services in the community. I need to know what other means as far as language in the community. I need to know what does that mean spiritually. I need to know what that means educationally. So just think about how diverse Middlesex County is as a total, and the residency here in this county. And then try to match that with mental health, developmental health, with substance abuse needs. Pretty difficult, but we're trying our best. So then we had that remaining language of Arabic, Farsi, Urdu, Hindi. Again, it trickles down to those 1% of, those are still families, right? And those are still kids. And some of them may live here in South Brunswick, and in South Plainfield, and some of them may live somewhere else, but they're still part of your community, and they're still in need. So we're really trying to utilize the resources that we have at this time. Language lines, right? Medicaid resources, what does that look like? Can we go back to somebody who can translate for them, a community entity, or really somebody, when we talk about the wraparound philosophy, we talk about utilizing the family's natural resources that are unpaid for, that when we leave in about a year, because we usually stay involved in about a year, that they're left with the whole group of individuals who are their team, that are unpaid professionals. We're paid to be at the table. We're gonna work, right? I mean, I think we know now that social work in general, we have at least a really hard job for the next 100 years. So we're here for it, but we also do know that families don't want us involved. They want to be able to stand on their own. They want to be able to access the resources on their own. They want to be able to go to their neighbor or their church or wherever they receive services from or support from naturally. So we want to help them do that and do that well. When we talk about out of home, yes, we have the ability to send, I don't want to say send, to coordinate youth who need to be out of home. That is the last thing we want to do, is have anyone not live within their natural setting, especially when we talk about youth. So our goal is always to have youth back at home with their families and in their community. Out of home is not forever. Out of home takes system involvement, and it usually means that we've exhausted all the natural resources that are available at the time. So it's a process, it doesn't happen overnight. And right now, just like everyone else in the world, it's a struggle, right? Staffing out of homes, finding good out of homes. So our goal is always, if we can keep a kid at home, we're going to do it. Telephone numbers that are really important. Again, Perform Care information, Perform Care website, my info. You can always contact me. I see that the Zoom bar is in the way, but that's okay. You can go to our resource net, which is a database of resources in Middlesex County. Just like 211, they have information about housing, about rental assistance. We also have information that is directly correlated to majority of the things that we're doing for families. So mental health resources, in-home resources, things of that nature. So it's a really good database. The information is also in the back, and the website is middlesexresourcenet.org. We try to keep it updated as much as possible with stuff like RFPs that are available. We even have our own that we offer on a yearly basis, and that community-based organizations can apply for to expand and create new services. Our social media contact, I think everybody is pretty plentiful on social media. We're trying to make sure that we are accessible, especially to kids or anyone who's in need. So our Facebook, Instagram, and LinkedIn, and then wraparound works. We know it does. We know we have the research, we have the data. We just need to make sure that we have team members like great providers in the community who are willing to look at plans for families and create one, so that families aren't following 3, 4, 5 different plans for all the systems they're involved in.
Okay, in the online Keep Middlesex Moving, are all these programs advertised with numbers? Do they go into the TAP as flyers in the South Plainfield Observer? Because there are so many people who have no idea where to start, or who don't even NAMI, they don't know who to go to and where to begin. So if that was put on that online, keep Middlesex moving, or like in the tab of the, it could help. You know, you don't have to put the whole explanation, but if you, like the 211, how many people know that, the 988? So that's just an idea that could help people.
No, I think that's a great suggestion. I'm hoping we're there already. Like, we have been in existence for almost, well, we celebrated 20 years in August.
Wow.
So, and again, like the multi-level way to get into us is a little, like, you know, cumbersome to some people in their minds of like, well, I want to be able to call you directly and send my kid to you directly. I want you to serve my family directly. But that's not really how it works.
Mhm.
So just having the ability for families to even research and find out some info gives them, I think, a step up and willingness to like reach out if they understand it, if it's available. Access, again, I think is the most important
Just
part
like
of this.
a little flyer or not with with too much detail,
Yeah.
because then it takes up space, but so people can say, oh, I need this, I need that.
I think we are, but I can always double check.
Okay, I get that, but I don't see
Yeah.
that advertised.
I'd have to check.
Okay.
Questions about performance?
Thanks.
Lisa, just a question, actually this is more for Ray, because you have the slide up there with the three numbers in it.
Ray, do you wanna come up just so that
Yes.
the viewers can, and then we'll do it, and then Trevor can come up to answer the
Okay.
question. Thank you.
But adding on to what Debbie
Thank
asked,
you.
one of the problems is when you're a family or an individual's in crisis, maybe a person with the verge of dementia, someone with an IDD diagnosis. There's those three numbers, there's ResourceNet, I'm glad Lisa brought that up. There's a dozen other hotlines out there. What's being done to coordinate that to make it so that it's a single point of entry when somebody's really looking for help? Because these systems don't work, you know, smoothly. So what's being done along those lines?
Well, that's why I can't really speak on 988 because we're not them. For 211, we try to get someone who's having a crisis, we try to get them to someone that can assist them right away. We could connect someone to 988, but realistically, that's just speaking to somebody. So if somebody says that they need, well, 988 is a texting platform, it's not actually speaking with somebody, am I correct? You speak to somebody? Because it's new, we're just getting involved in it too, our director is working with the council and everything. So for us, we try to get someone who's in a mental state to try to get them to that person that can speak to someone right away. I don't think from our phone, I don't know if we can dial 988 the way our phone system is set up. So we have to dial an 800 number. So if you have an 800 number, then we can connect someone to them. We try to warm conference them over to them so that we can explain this is what they're going through, this is what their need is, and then we try to smooth transition it over so we can disconnect. Anybody can call us. We have people call us who say, oh, I meant to dial 911. Not a problem. What's your emergency? Like, depending on what it is. If they're saying they have chest pains, I'm not gonna disconnect from the consumer. I'm gonna continue talking to them. And on the back end, I'm dialing our backdoor number to the police to say this person is having chest pains, they need emergency assistance. Well, where are you located? So it all depends on what the person's need is or what their situation is. I mean, I've had people who talked to me through chat who wanted to harm himself because he couldn't talk to his parents. The first thing I thought of is, can I call you? I'm not gonna talk to you through chat. And I called him and it broke my little heart because he was a 17-year-old little boy and he was the same age as my son. And he just couldn't talk to his parents because he said it was his girlfriend, but I don't really think it was his girlfriend. I think it was a little bit more. And then I was like, okay, we talked to him. He said, thank you, I'm really feeling better. Can I call you tomorrow? Called him tomorrow, he never answered the phone. So first thing I thought of is, oh my God, he harmed himself. So we are trying to find ways to make it easier, better. I'm open to suggestions so I can take it back to my director to see what she would want us to do. And just get better training, even if you guys could come into us so we can train our people how to handle crisis calls. Because it is a scary thing. So I'm open to suggestions.
There is a number for acute psychiatric services, if it's a psychiatric emergency, and I don't have that, I might have it in my phone, but they will kind of triage, they'll tend to tell every caller where to go. So if it were suicide idea or psychosis or any other kind of mental illness like that, they would do.
When it comes to crisis,
APS.
sorry, we only do bare minimum because we're not licensed counselors. So we only ask them, what are your needs, what is your plans? So depending on how they answer it, is how we direct them. That's it. If somebody says, no, I think about it, we try to get them to a hope line. Somebody that they can just talk to guide them, why are you having these problems? We're not gonna go into details. One is scary. But if someone says 3 to all 3 questions, like they're gonna have the plans, the means, we automatically call the police. Try to keep talking to them, find out where they are, what are you wearing, where are you located, what do you have, and just try to pass that along.
Probably APS would be good to pass those along rather than police. Or you could talk to your director about it.
Services?
No, APS is acute psychiatric services.
So yeah.
So that it wouldn't be just police, it would be police along with somebody who's trained for psychiatric situations. Okay, to get more information.
Any other questions in the room?
I have a couple. I'm sorry, I wrote them down because I'm gonna forget them. For Gay and Jordan. So Gay,
Go to the podium, just so our viewers can see, please.
So Gay, just a quick question. First off, I want to say, thank you for mentioning the self-paced programs you have. I know a lot of people now may not prefer them, but it's what works for their family or themselves. So thank you for saying that you have some of those. And just all of your programs, are they free for participants or is there any fee charged? All free, perfect. Thank you, Gay. And then Jordan, just a quick question. So I know you're in the schools and you're doing a bunch of stuff during the school year. During the summer time, are there any programs, are there any options? Can people go to the path? Can students contact you or is it strictly September through June?
So right now in South Plainfield, we're just in the school during the school year. But I do know in Carteret, during the summer school, we have a program where they actually go to the summer school program. And then since those people are working over the summertime, their students are able to pop in and see them if they need to. So hopefully that'll be something that we can do in South Plainfield in the future. But for right now, just in Carteret. Go for it.
And I have a question for you too. So for students who might need ongoing care, maybe one-on-one counseling weekly, is that something that they need parents' permission for?
Yes, so students that are minors, which in my case is pretty much all of my kids, I can see them one time, but then after that we do need parent permission to be able to continue services. So then if the parents are not willing, I normally would refer them to the guidance counselor to make sure that they still do have a connection. And then I would send a follow-up email to the family to give them resources outside. So then that way I make sure that something is still happening.
Just sort of like the last opportunity to ask questions,
No, we're gonna do in-room, but we're going to online questions. You have a question?
sort of, it's sort of an awkward question, it's not to any of the presenters, it's actually to the folks in the room. I'm just curious if most people are here as parents or as teachers or as professionals.
A lot are professionals, are speakers. I'm here organized as a parent, because it hit me very hard, and I did see the need for resources.
Yes. The reason I asked the question like that, and I don't want anybody to have to say, why they're here, but I would definitely echo what Ms. Pott said at the podium. As much as we would all want to learn about the system, when you really have to engage it, it's very difficult. All of these folks presenting, I know them personally, but I've worked with a lot of people like them, and they all want to do their best to make sure they can connect people. But even with that, it's challenging. So if you're here as a professional or as a parent, I would just encourage you to either speak with some of them today while you have access to them privately, just to really squeeze them for information that you might need, or to make some connections here within the room amongst yourselves, just so that you can really get to the sort of brass tacks, so that when you need the help, if you need the help, you can get it.
Take some of the literature with all the phone numbers and the web addresses and stuff.
We are also, just so everybody knows, we're recording the meeting, so it'll be available 24/7 to those who aren't tonight, so. Do we have any other questions in the room? Okay, we'll go online. Do you have any questions online?
Doesn't look like it.
No questions?
No, so
Okay.
you can see right there.
Well, all
All right, that concludes our seminar for tonight. Thank you, everybody, for being here in person, online. Again, there will be a link to view the entire recording. Feel free to go around, talk, engage, get some information, lots of information out there. Thank you again to all of our speakers. Just very useful information. I really appreciate it. And I'll be doing the prize drawing, so. That's it. Thank you.